saw it during the meeting, because the main idea for each of these meetings was to see how we were feeling about receiving feedback in our program. So basically in our rotations and general feedback, right? So our PGY2 class, basically 68, 70% of us were present, and basically all of us were unanimously agreeing that feedback is very limited. So there's a long road to go regarding feedback. We were also told that feedback is that it's not our own feeling, right? It's not just the PGY2 group, but it also is going on with the PGY1 and PGY3 group. So, okay, without further ado, the reason I am making this video is in order to communicate this to all of you, because I know that some of you are busy in the hospital and won't be able to see this at X or Y moment in time. So this way you'll have this accessible and you can see it whenever you want. If you think different from whatever I'm saying, or you think I'm incorrect about X or Y, please let me know. And actually, I'm going to try to make a group chat, which I'm going to get to in a moment. And I'm going to add this link on the group chat. The idea is for us to have a group chat in PGY1, 2, and 3 involved. So what happened in the PGY2 meeting? Basically, number one, we understood that feedback is very limited in general, and this isn't something that is happening only on the receiving end. It's also happening on the sending, us being the ones who provide feedback. Why? Because we also have to provide feedback to our students and our co-residents and our attendants, and there's also a limitation with that. So we also should understand that this is happening at all levels. So basically, there is a difficulty with feedback, and feedback is a form of communication that basically tells you what you can improve upon for the future. So being a problem of communication, I spoke at the end of the PGY2 meeting, and my idea was to have a group chat where PGY1, 2, and 3 are all there together and can exchange ideas. So my idea is for us to have an academic chat, and this is a chat where you would be able to ask, hey, I forgot how to replace phosphate. Does anyone have this or X or Y tool that Dr. let's say Axonov mentioned? So we could share that. Number two would be, hey, I have no idea, should I put this patient in observation status, or should I admit to the inpatient setting? Or what was the medication that required it to be in the ICU? These are the questions we could pose in this chat. We could also share articles, so we could also go to morning report or noon conference, and we all probably have some article that we might think, oh, this reminds me of this or that, or I'll look this up, and then we look it up and we don't share it. And there's no way of sharing nowadays, and the status quo for the last years has been PGY1 has a chat with PGY1 has its own chat, PGY1 has its chat with PGY2, and that's about it. And there's never a chat involving everyone. PGY3, when they become PGY3, they don't have a chat with PGY1 and 2. So our medical residency is only 3 years, right? So it's only 3 years. Yes, I understand that PGY3 has its applications and thinking about, I'm moving out of state, I'm doing this, I'm doing that. Yeah, but you're in residency, right? We're still in residency. It's a 3-year program. You're still in residency. You don't have to see every single message. You can actually mute the chat for a while. And whenever you think you're available, you can be helpful, because that's the idea in medicine and in life, is give back to those who come behind you. So that's the idea. So why do I think that PGY3s can also be here and PGY1 to everyone? Because we're a group of less than 60 persons. So from where I come from, we had a WhatsApp group chat with approximately 160 persons. So all internal medicine was there, and several fellows from different specialties. And I was there when I was a PGY1, 2, 3, 4, and 5. And I was okay with it. Yeah, in the end, maybe I didn't want to see all the messages or whatever. Yeah, so we had 2 chats, the academic chat and the social chat. So here's where you're gonna be like, oh, you also want to make a social chat, another chat. What for? I don't want any more chats. So in the end, I believe that it is important that we have the 2 chats. Why? Because when you only have 1 chat, suddenly people start sharing memes and start the jokesters start putting all these jokes in the chat, and that makes the people that are only interested in academics and only interested is there a noon conference or not? Is there an interesting article someone read or not? Or things like that will get demotivated by having to go through all this joking and memes and all that. So for that, we should have a social chat where we can joke, when we can share. We are a community, and when we finish residency, we will know who our PGY1 was, PGY2 was. We'll know till the day we leave this earth. So we're a community. It should be good to be in touch, and yeah, we are social beings, so it's nice to be able to just send a message. And it would be nice to say, oh, I'm going to work out X place today. Maybe you don't like working out, so maybe you're not interested, but maybe there's 15 or 5 persons who are interested. Or maybe I'm going to play paintball, so that would be nice. Remember that any strengthening of our relationship as residents, and not necessarily in the academic field, will improve our academic achievement in general, and will improve also our possibility of helping the patient. So in my case, sometimes I don't want to see the social chat, sometimes I do. So yeah, you can also mute it whenever you want to mute it. The other thing I want to talk about is, so yeah, it's important to have clear communication. So part of this feedback problem going on is a lack of communication. We have to start communicating. We have to communicate effectively. We have to be assertive, and of course that includes being respectful. But we have fallen into silence, right? So I don't think it is healthy that this idea of always separating the PGY3 from the rest is a good idea, because we're residents after all, and yeah, there is the hierarchy, and we do understand it exists, and everyone will respect it. But don't you think that having the capacity to just send a message asking something and having at your disposal 60 persons, 60 brains that could actually answer that work? Because you're not going to send an email to 60 persons, right? Like, hey, I don't know what to do about this. You're not going to do that, but you can send a text message. So why now? Next point. Why WhatsApp over regular SMS? Because we're using regular iMessage, SMS. I'll tell you the benefits of WhatsApp. So if you see programs around us, actually, there's a lot of programs. If you go to Florida, most programs use WhatsApp. If you go wherever there's a lot of international medical graduates, WhatsApp is the go-to app, because everyone uses WhatsApp out of the United States. That doesn't mean that in the United States it doesn't work. It just means that in the United States, regular SMS works for most of the people that have non-complicated communication. But we are a syncytium of 60 persons, where we should sometimes want to share a picture of this pathophysiological thing, or a picture of an interesting clinical finding that the patient signed, and you have the consent, etc., all good, and yeah, the hospital has told you you can share this image that doesn't disclose any personal information. You know how it goes. But I'm just saying, if you have anything interesting, you can share a picture, you can share an audio message. It is immediate. What else? You can't do that. You can share image and audio. Maybe audio is more limited in regular SMS, or you can share longer audios, but you can search it after. So let's say we have this chat and we want to search a topic or a term 3 months down the road, and you're like, let's say example, the phosphate. I already asked about that. Someone already sent it to this chat. So you go into the chat and you search the word phosphate, and you'll find it there. Or you can even star messages that you think will be handy in the future. Or you could actually send a link, and you can go to the link tab, and all the links will be there. Or document tab, pictures, all the pictures. And this is a very effective way of using the messaging for communication. Of course, this isn't the way you will be talking about your patients and providing their personal information, because for that you have, the specific application that is made for that with its end-to-end encryption plus whatever else it has, because of course WhatsApp also has end-to-end encryption but has its limitations. So that being said, that is why I would recommend the whole team to use WhatsApp over everything else. I have a lot of experience using WhatsApp, and I know the tool it is. I still have my previous residency program WhatsApp archived. I have it there, and I sometimes go and look it up. I already am not part of that chat, but everything is stored there, and I still have access to seeing almost all my previous residency right there. So I think it would be a disservice not telling you guys about this option, and that is the reason I asked after the PGY2 meeting ended about how could we improve communication, and I proposed the group chat, right? And the coordinators and persons in charge of the meeting thought it was a good idea and told me to go ahead with it. So that is why I am making this, making a cross residency chat, academic, and the other one is going to be social. I beg you to not go out of the chat, because it would defeat the purpose, right? If you don't want to see it, give it a chance. Silence it for 1 month if you want, and maybe you'll start seeing that the chat starts growing. There's also the possibility that the chat doesn't work at all, which I believe that shouldn't happen, because I've seen this function in general. If it's not functioning, I think it tells us more of ourselves than of WhatsApp or of the technology. So basically, this is an idea that we improve communication. This chat would be for residents only, because we are a specific species, and attendants shouldn't be in the chat, because I've seen that when attendants are in the chat, things change a lot. So I've already seen that in the past. So it's better that residents made by the residents for the residents. And it is good that we start having a voice, and we start growing academically, professionally, and help our patients the best we can. So if you have any questions or anything, let me know. That's about the group chat. And I understand that it will start too slow, and I was going to say something else, but I think that's the point of the group chat. And that's it. We'll see how it works out. As I am sending this message, you'll see that probably people will just get out of it beforehand. And right now I'm telling you, WhatsApp has already, you could say, no, I don't want to install WhatsApp because it's too many gigabytes. No, that's false. It's just kilobytes. And if you have a work phone, which you do, it's nothing, right? And you can erase it later in the future. So it's not like, oh, I have to buy an external hard drive to be able to download this app. So no, that's not a reason to not download WhatsApp. Privacy concerns, that's another reason for people not downloading WhatsApp in the past. Well, if you have a Facebook, yeah, that's it. Facebook owns WhatsApp. Facebook owns basically all our information. And I guess all of you have a Facebook, and what else? Or however it's called now, Meta. So yeah, you already know that people are selling your information everywhere, and that's why you get this directed ads specifically for you. So yeah, if it's a privacy concern, you can talk to me about it, but I think wouldn't make much sense if you're with a mobile phone and you're able to see this video. You're probably not living in a mountain and worrying that no one has access to your name, right? So I don't see any negatives to this, but that doesn't mean I'm right. That is my own perception, right? So if there are negatives and whatever, let me know and we can talk about them. What I really wish this group to do is to download the app and use it, and people not starting quitting and leaving the chat without seeing the video, just because a fellow co-resident made this video to hopefully improve all the relationships through communication and end up improving patient care and the whole program as well. So that's it. See you guys later, I guess, in the hospital, and that's about it. Peace.